Endoscopic ultrasound is the combination of standard endoscopy, where we have a flexible lighted tube with a camera on the end of it, where we can look on the inside of the intestines to diagnose certain gastrointestinal disorders, as well as with the fusion of ultrasound technology to allow imaging outside of the intestines, particularly in use for staging cancers to tailor therapy. I think the primary benefit in this day and age for most of the uses of EUS is for tailoring therapy for patients with cancer and allowing them to get the appropriate therapy to give them the best chance for survival. In patients that do have an early cancer, we can confirm that and allow them to go get curative surgery, whereas in patients that have more advanced tumors, we can allow them to get concomitant chemotherapy and radiation to give them a better chance of fighting the disease. In some cases, we don't know that there's a cancer, but we suspect one, and this technology gets us much closer to the organs that we're concerned about than from X-ray modalities like CAT scans and MRIs that take pictures from the outside. So we can actually get closer views of these areas in folks that we suspect may have cancer but just can't find one on X-rays, and can actually go in there and biopsy it to confirm that there is a cancer there in X-rays that previously have not shown anything to date. From your perspective, we would basically sedate you and you'd be asleep during the procedure. We place a small tube with a light in the camera and the ultrasound transducer on the end of it down your throat or up inside your rectum, depending on which type of cancer we were looking at, and then carefully maneuver it into the location of where the cancer would be to get better images of that cancer. What that allows us to do is get a sense of how big that cancer is, to determine if it has grown into any structures close by, to determine whether it's resectable by surgery, as well as to see if it's spread to any close by organs or any lymph nodes close by that might require chemotherapy and radiation to get rid of. It has played an important role in diagnosing cancers that previously were very difficult to image, such as pancreas cancers and biliary cancers, and also often can change your staging based upon what you've seen on CAT scans and things like that, and make sure that folks don't go and get a surgery when they cannot be cured by surgery, or folks that need chemotherapy can go ahead and get chemotherapy if they need it. I think the biggest benefit, it allows them to get the best possible therapy for their cancer to make sure that they have the best chance of getting rid of it.